Hi all, and welcome back. My name is Josh Stevens, and I'm sitting here having a conversation with Cara about how to mitigate risk in the maternity setting. Cara, welcome.
Hi Josh, thanks for having me back. So as you know, I am an NHS midwife and need to share my stories with you.
Brilliant. So in a previous conversation, you were touching on how it's difficult often to get all the right information from the pregnant woman and how important that is, particularly in maternity, having the full scope of information. Why is it especially important there?
Well, I think in any healthcare setting, we need to be able to have the correct information and the correct history in order to plan care going forward. I think the challenge in maternity is the situation can be time pressured and it can be very stressful. And, you know, for women who are coming in, they're already quite vulnerable. So getting that information can be tricky sometimes. And, you know, it could be something so simple that they just don't think of at the time. For instance, you know, like I gave you the scenario last time with the woman coming in who's about to give birth, you know, and you say to her, have you got any allergies? And she'll say, yes, codeine. And okay, red wristband goes on and no more questions are asked. But, you know, it might be more than that. She may have a peanut allergy that she's, you know, not thought about, or she might have a latex allergy that she's just not thought about at that time. Or, you know, there could be a whole other amount of things, but she's only thinking about drugs because she's thinking, I want pain relief. And so therefore that link is to drugs. So there's a whole host of information that can be
Sorry, are you saying that they could just have more allergies? Are you saying that's related to having the initial allergy?
Well, I'm saying they could have more allergies that they've not thought about at that time because all they're thinking about is drug allergies and not necessarily other allergies that they've not linked to the clinical setting, like latex, for instance.
Right. And is this a bigger impact for mothers? Like often we know that they're quite vulnerable with the state they're in, and there's, you know, they're about to bring another human in as well.
Yeah. And, you know, especially if it's your first time engaging with maternity services. And I think the thing that's important here is that women are already vulnerable in that situation because it's brand new for them. They're scared, they're overwhelmed, or whatever else is going on for them. Or, you know, they might be looking to have the perfect birth, etc. But for women, particularly with like a latex allergy, for instance, they're already in a vulnerable group of our demographic purely for being women and having a higher chance of a latex allergy, for instance.
So this higher chance of latex allergy, is this just the mother or is it also the child? Or?
Well, for the mother, certainly. Female population is at a higher risk of latex sensitization purely for being female because latex allergy, sensitization certainly can come from repeated exposure, and that sensitization can lead to allergy, and allergy can lead to anaphylaxis. So when you put it in that kind of pathway, you can see already how that can escalate. But for women, the sensitization can occur more so because of the repeated exposure that they may have just through being a female. So you're talking cervical smear tests, you're talking investigations for menstrual issues or, you know, condom usage. Just those things alone are at a higher risk because you're female. So you're already putting women in a situation where they have this higher chance of sensitization, and then added to that in a clinical environment.
So the more and the longer you're exposed to the latex, the higher the likelihood of becoming sensitized.
Yes, it does come from repeated exposure. And the thing is as well for women is that, for instance, if you've gone into hospital and you've had a baby and you have a latex sensitization that you are completely unaware of, you can dismiss it for the fact that you're recovering from having a baby. So you may have been exposed antenatally to latex and then in labour to latex and then perhaps cesarean section latex or epidural, you know, all of these things are exposure to latex. And then in the recovery period, you could have a wound that is healing, be that from cesarean section or from the type of birth. And the reaction that you have from latex might be dismissed as being in recovery from having a baby. So then when you come into the clinical setting again for another baby, you're unaware of this sensitization that you've accumulated the first time round, and therefore it's not part of your clinical background and you don't know that information. And with all of these repeated exposures previously, it can then turn to a full-blown allergy with anaphylaxis without knowing.
When you really list out all of the different touch points where the exposure could happen, you realize there's a lot.
It's a lot. And you don't really think about how serious that can be for a woman who's accessing maternity services, thinking she's in the safest place possible and that she's looking to have the best outcome possible. And you're not just talking about the woman, you're then talking about the baby as well, because let's face it, if something happens to the mother, then you're left with an infant and it affects both of them. And it's really quite scary when you think about the depth of, the seriousness.
Well, you said in the safest place possible, but they're also at their most vulnerable.
Yes.
Both of them.
Yeah, absolutely. And putting their trust in all the people around them to make sure that they are safe.
And this really ties back to what you were saying in a previous session about the deeper questioning.
Yeah.
And having to really garner that information and have things changed as the exposure has continued.
Yeah. And I think when women automatically downplay symptoms and things because, well, it's childbirth, so therefore I have to put up with it. I chose to do this. It's what women do. There's all of that element to it as well. So when they come back and give you their medical history of their last birth, and they'll be like, oh, it took me ages to recover last time. And it all felt so sore and painful. And it's kind of like, oh, well, it's childbirth. So therefore there's no kind of further looking into that. And well, maybe there was some kind of allergy. Was it an allergy to the sutures? Was it an allergy to the latex? Was it an allergy to the catheter? It's all of that kind of more in-depth kind of questioning and knowledge and even investigations that we kind of dismiss.
Can we influence, the rates of sensitization to latex in these settings, the gynecological?
Absolutely. By eliminating the latex part of a clinical setting, you're already making that a much safer place for all women and families, birthing people, babies, infants, children, all of the people who are accessing services. It's already a much safer environment because you've mitigated that risk of repeated exposure.
So if it's exposure that sort of increases it, then really as soon as you're born, you want to minimize.
Absolutely. Absolutely. And that's the thing. It's when you look at the life cycle, if you like, of allergies, if you take away the actual element of the risk, you're mitigating development throughout life from birth.
Yeah, Claire. Is it as easy as that, though?
It sounds easy, doesn't it?
It always does.
It sounds so easy, but it is a very simple step. It is a very simple step to take to remove latex from the clinical setting. You're also, not only are you removing the risk, you're also making a much more simplified and streamlined clinical setting because you're also taking away repeated exposure for healthcare workers, for instance. And when you look at the statistics on healthcare workers with, type 4 skin allergies, it's really quite huge. In general terms, you're talking much higher percentage of healthcare workers who then have repeated exposure, skin allergies, time off work, then prescripted special gloves and equipment or special hand creams that are prescribed. And that's all time and resources that you're talking about here. And that's not to mention if then a patient comes in with an unknown allergy and the time and resources that you're talking about there with then having to clean a room or downtime in theatre and, swapping out equipment.
So it's quite interesting that you talk about what the risk is for the healthcare workers as well, because we've become so focused on the patient and the safety for the patient. And then you're working in this healthcare environment that's really centered around safety. Mm-hmm. Yet you also need to look at what you're exposing the healthcare workers to, what the impact that then leads on to.
Yeah.
with delivering the care.
And you'll also often find that healthcare workers are the least likely to kick up a fuss about it because they know the impact that it will have on their colleagues if they were to take time out of the clinical setting in an already understaffed environment. So you'll often find that even with healthcare workers, a lot of cases are unreported.
I mean, healthcare workers' health needs to be looked after first so that they can actually deliver the right care for the patients.
Yeah. You would certainly think so and hope so. But yeah, you're doing the healthcare workers a huge disservice by not eliminating that risk for them as well.
So in order to eliminate the risk, obviously the healthcare workers are going to be constantly exposed to it. But what about actually identifying sort of the allergies early or sort of before procedures happen? Is there things in place for that to happen, and sort of people that have, or healthcare workers even that have developed an allergy, or patients, to keep them away from it?
In terms of sort of latex exposure, you mean? Well, I think the problem is like I say, healthcare workers are more reluctant to document any issues. You've then got the, what's the word I'm looking for? You've got the problems with, equipment, etc. So you have these policies in place for people who come in and will say, I've got a latex allergy, and then they'll wheel out a trolley full of latex-free products. And to me, that just seems absolutely crazy that you have the equipment there, but you're reserving it for people who are only stating that they have a latex allergy. Why are we not treating everybody as being a potential risk when we already know, because I've just said that women are of a higher risk anyway? Why are we not eliminating that risk across the board and for healthcare workers so that we can have much more beneficial service? You're eliminating a risk. You're having less time off for staff. You're having less procedures for staff in terms of tests and OcuHealth and all of these different things. And then you've got, as well as different sets of equipment for different people. It just seems absolutely crazy to me that you go to all these extra efforts to provide all this stuff for different people when you could just streamline the whole lot.
Yeah. I mean, I'm sold. But nothing comes easy. Is there extra training that needs to be done for people to understand, or are these risks understood and they just accepted?
I don't think the risks really are that well understood. And I think that education is key because, yes, I'm sitting here saying remove latex and you've solved a problem. But there is much more to it than that, because you can have people who have different reactions to different things within different materials, for instance. And I'm not going to go too deep into it, but you can have reactions to different types of chemicals. That's a whole other story. And for those people, they do need to have properly prescripted creams and tools, etc. But when you look at it as a whole, when you look at how we can streamline things, and when you look at the lack of knowledge and awareness around it all marries up so well, because once you know women are more vulnerable, once you know that women are at a higher risk, once you know that repeated exposure can lead to anaphylaxis. And I say this, even though this is rare, it is rare that women will have anaphylactic reaction to latex, but it does happen, and that is a risk. And that's a risk that is a ticking time bomb. And that can lead to huge litigation, huge costs, as well as all the other things that I've already mentioned. And then on top of that, you've also got the safety aspect of even going into obstetric theatres, for instance. There's a research paper that was a retrospective review of a latex allergy in the clinical environment. It's a paper that I'm sure we can link people to if they wanted to read more about it. But in the retrospective review, they looked at cross-reactivity. One of the things that latex was cross-reactive with was oxytocin. And that is used routinely in the obstetric theatre as a way to remove the placenta once the baby is out. And it's given routinely. So if you've then coupled a latex exposure with oxytocin and you're doing that repeatedly, how long is it until we have another one of those cases? And that's a huge, huge, huge alarm bell to me. And I think once people are aware of that and they know these statistics and they know what the risks are and how severe it can be, to me, it's just such a simple fix.
So do staff get trained on, obviously, latex allergy? Because you talked about earlier, they get the band put on them when they have an allergy, that red band. Is there like a clear training, like this is what happens? And is it just needing to understand how much more interrelated everything is? I mean, you're just talking about cross-reactivity there. Is that what the training needs to be? Or?
Yes, I think so. I can honestly say, hand on heart, I have never had any training on latex allergy in my time as a midwife. And I've been in that NHS system since 2013. I have never known what kind of side effects or impact latex has in women's services. I've never known that. And hand on heart, when I've done all of this research and this reading, and it has absolutely blown my mind that we have this ticking time bomb sitting here and people aren't taking it more seriously.
So obviously you've read up, you've studied, so now you understand. How do we change that though? How do we change it so that, because not everybody's going to do what you've done, people need to understand the risk to the patient, or do the healthcare workers need to understand the risk themselves?
Both.
I mean, it's kind of like there's the mothers, there's the babies, there's the healthcare workers. It's like, save them all.
Yeah, exactly. And this is the thing, in order to have an effective service, we need to have effective healthcare workers. In order to have effective healthcare workers, we need to have effective environments. It all links in together. And I think there does need to be more education. I do think that we need to be shouting from the rooftops about the things that we are using, the tools that we are using in our workplace. When you think about a building site, for instance, when you go onto site to use equipment, you're trained in that equipment. You know how it all works. You know what the safety regulations are for it. But when you go into the clinical environment and pick up a catheter or a pair of gloves, are you actually fully aware about where it's come from, how it's made, what the safety element is of it? I honestly, hand on heart, don't think that anybody could tell you the ins and outs of the equipment that they're using. It's just a given that that's what you're using.
But this comes back to one of the challenges of where there's so many different things to be aware of working in that space. There's so many different sort of policies, learnings, what's going on with the patient, what's going on with the other workers on the ward. It's incredibly complex.
It is. But as I said earlier, all midwives do a yearly update. It's such a simple thing to add in about hand hygiene, hand care, the tools of our trade, just to pop it into that yearly update so that we are all more aware of how to look after ourselves and therefore our patients better.
I mean, I think you've kind of captured something I was sort of leaning on earlier, where the healthcare workers need to be able to look after themselves best in order to deliver the best sort of equitable care.
Yeah. And it is something that I don't think healthcare workers fully take on board, that, we kind of put ourselves second in order to care for our patients, but we really do need to take care of ourselves.
They don't need to martyr themselves.
No, absolutely not.
But we love them.
Exactly.
Awesome, Cara. Thank you very much for that one.
Thank you.